I was 7 or 8 and I fell off my bike and broke my wrist. And so I had to have surgery. And I just remember being fascinated by like loving the orthopedic surgeon that I had and just kind of enjoying the process, even though I was an injured kid, but I just thought it was like a really cool just a really cool thing. I've always loved just interacting with people and getting to know people on a very like personal basis. So family medicine was perfect for me because I love like the long-term relationships that happen in primary care specifically, and then getting to know the whole family at the whole time, you know, get to know everybody, not just an individual. So it really helps take care of the whole family. The first visit, I always like to try to just get a little sense of who they are, you know, some of their, obviously their medical background and things they've been through and kind of how they came to me in the first place, you know, what kind of brought them into my office to begin with, and then just trying to address as many things that we can in primary care. I actually have extra training in sports medicine, so so I do have an extra interest in like orthopedic care. So I see a lot of young athletes, but then I also see a lot of adults with like arthritis and overuse injuries. So I do a lot of injections and some basic fracture care, and then just kind of musculoskeletal complaints as well. I love actually explaining things to patients. I think it helps them understand like what's going on with their symptoms or their disease or whatever it is that we're talking about that day. So I really try to break it down to a way that they can understand what's going on medically, but also my approach and my opinion on things. And so I like to try to give them options, say that this is maybe what I think is the best, but if you don't like that, you know, we can maybe go down this route too, and I think that would be safe and appropriate. So my goal is always to give people, empower them to help make the decisions when we're deciding what to do with their health care. I just try to always be empathic and understanding and try to like meet them. I feel like it's my job to kind of educate and make recommendations, but it's the patient's job to decide what they want to do with that. And so I think my role is just to support them in that and try to do the best that we can to keep them as healthy as possible and achieve the goals that they're trying to achieve by coming to the doctor.